Hey everyone, welcome. Today we're going to talk about something huge, something that's on pretty much everyone's mind when it comes to childbirth, pain management. We're going to cover the whole shebang, from breathing techniques all the way to epidurals. Okay, so let's just jump right in with a question that might sound a little strange at first. Can that really intense pain of labor actually be a good thing? It seems totally backwards, right? But the answer, well, it's pretty fascinating. To get that answer, we kind of have to flip the script on how we think about this specific kind of pain. See, when you get hurt, pain is a warning sign that something's wrong. But labor pain, it's a sign that something is going exactly right. It's a productive, purposeful part of this incredible natural process. So you see, this pain actually has a job to do. It's what instinctively makes a mother move around, change positions, which in turn helps the baby make its way down the birth canal. It also pushes her to look for comfort and support. And here's the big one. Unlike other kinds of pain, this one has a clear, amazing endpoint: a new baby. Okay, this slide gets into something really interesting: the difference between pain threshold and pain tolerance. Your threshold, that's the point where you first go ouch, is pretty much the same for most people. But your tolerance, that's how much pain you're willing to handle, and that can be all over the place. It's affected by fatigue, your culture, your support system, everything. And that's a huge reason why your experience is totally unique. And this right here gives us a fantastic way to think about it. The 4 Ps. You've got the powers, which are the contractions; the passage, that's the mom's pelvis; the passengers, the baby's size and position; and then there's the psyche, the mom's mental state. And that last one, oh man, it's huge. Being anxious can literally make the pain feel worse. A calm mind is a powerful, powerful tool. All right, so let's start with the first line of defense: drug-free comfort methods. These are all about working with your body's own amazing responses to help manage the pain. So the key idea here is called the gate control theory, and it's actually pretty brilliant. Picture this: you've got these little gates in your spinal cord. Pain signals travel on tiny little nerve fibers, but other feelings, like pressure or touch, travel on bigger, faster fibers. So if you can get those big fibers firing, they can basically close the gate on the pain signals, stopping them from ever reaching your brain. And here are some super practical ways to actually shut that gate. Firm pressure on the lower back, sacral pressure, can be an absolute lifesaver, especially for back labor. Using a heat pack or a cold pack sends competing signals to the brain. Even a simple light stroking on the belly, called effleurage, creates this pleasant distraction. You combine all that with focused breathing, and suddenly you have a lot more control over how your brain is processing everything. Okay, a quick but really important heads up on breathing. If you start to feel dizzy or you get that weird tingling in your hands and feet, you're probably hyperventilating. That's your body's signal to just slow it all down. Take a nice, slow breath, or even breathe into your cupped hands for a second to get things back in balance. All right, so for a lot of people, as labor really ramps up, medication becomes the next step. Now, it's important to know these aren't usually meant to erase the pain completely, but more to just take the edge off, make those contractions more manageable. When it comes to these meds, timing is absolutely critical for safety. There's what's often called the 1-hour rule. Basically, you avoid giving certain opioids if the baby is likely to be born within the next hour. Why? Well, it's because the drug could be at its strongest right when the baby arrives, and that could make them a little too sleepy to take good, strong first breaths. And to help remember all the things to watch out for, there's this handy little mnemonic: NARCS-U. It's a quick way for medical teams to keep track of the main side effects they need to monitor, from nausea in the mom to, most importantly, any breathing issues. So let's look at 2 common options. You've got fentanyl, which is fast-acting and can take the edge off without making you super sleepy. Then there's nalbuphine, which is also great and might have less effect on breathing. But, and this is the really, really important part, it absolutely cannot be given to a mother who is opioid dependent because it can trigger a really dangerous sudden withdrawal. Okay, now we're moving into the heavy hitters, what's known as regional anesthesia. These are the methods that block pain in a whole region of your body. Think from the waist down. And first up, of course, is the one everyone's heard of: the epidural. It involves placing this teeny, tiny little flexible tube, a catheter, into what's called the epidural space, right outside the spinal cord. And through that little tube, medication is delivered continuously for consistent pain relief. Now, this is a really important comparison: an epidural versus a spinal block. They sound similar, but they're used very differently. The big difference? A spinal is a one-shot deal. One injection, it works super fast. and you get a total block of sensation. It's often used for planned C-sections. An epidural, with its continuous feed, gives you a lot more flexibility to adjust the dose as labor goes on. And with these procedures comes a really important safety checklist. The absolute #1 thing everyone is watching for is a sudden drop in blood pressure or hypotension. So you get IV fluids beforehand to prevent that. Then your BP is checked constantly. They'll also keep an eye on your bladder and watch for a certain kind of headache that can sometimes happen after a spinal. Now, in those rare, true emergency situations where there's no time for an epidural or spinal, general anesthesia is the necessary choice. This means you're put completely to sleep. It can be a lifesaver, but it does come with more risks for both mom and baby, so it's really reserved for when it's absolutely needed. And all of this really boils down to one central theme. It doesn't matter which method is chosen. The absolute #1 priority is always the safety of both mom and baby. Every single option has built-in precautions. So let's just hammer this home one more time. The primary risk we're watching for after an epidural or spinal is maternal hypotension. The reason this is such a big deal is because a sudden drop in mom's blood pressure can affect blood flow to the placenta, which affects the baby's oxygen. And that's exactly why it's monitored so closely. And the solution is actually pretty simple and proactive. Before the procedure even starts, you get what's called an IV fluid bolus. Basically, they give you a big bag of IV fluids pretty quickly. This pumps up the fluid volume in your system, creating a buffer that helps keep your blood pressure nice and stable. Okay, the other big safety check we've talked about is what can happen with the baby. Since these strong pain meds can cross over the placenta, they can sometimes make the newborn a little sleepy and slow down their breathing right after they're born.
But, and this is so important, there is a safety net for this. It's an antidote called naloxone, or Narcan. It's this amazing drug that works within minutes to completely reverse the effects of the opioids and get a baby's breathing right back to normal. It's always ready to go whenever opioids are used.
So when you look at the whole picture, from understanding the purpose of pain to the incredible technology of anesthesia, there are more ways than ever to find comfort during labor. Just knowing what these options are is the most powerful first step you can take. It leaves you informed, prepared, and ready to have a real conversation about what's right for you.